thank you once again. It's a pleasure to be back into the conversation. And today as well, I'm going to talk about writing your essay for the postgraduate course that you're applying for. And I think this is a good bit for us to look into it, because most of the opportunities that are coming in, people are currently crafting their own essays, writing their applications. And as you're doing that, all I can wish for is that you become successful in that application, you give it your best, and you be the unique professional, unique expert that is looking for that opportunity for your own personal or professional development, but also for the growth and contribution to the society where you are hoping to practice. And that is critical for me. So when I look at that bit, then how do you write your essay? And most of the essays will always be coming, and it will be like looking at the journey that you've had, your motivation for pursuing the particular course that you've applied for, what is your vision after applying that, after learning about that course, and actually how you're going to practice with the knowledge and skills that you've gained. And at times they might link you to why specifically that university that you're going for. Why, let's say for example, why Oxford, why Stanford, why Edinburgh? Like there's so many questions that will come in. But for me, when I'm looking at it in terms of writing your essay for these particular courses that you're applying for, it is important that you understand what is your motivation for the course. And there's no unique answer, there's no specific particular response that will make you the ideal candidate for it. It is about you being able to tell your unique personal story in an impactful way and in a relatable way that actually there's a storyline behind it. Over time, I've always talked about documentation, because I believe documentation is the greatest asset that we have. We have the ability to write, we have the ability to do videos, podcasts, we have the ability to do videos in terms of YouTube tutorials, we have the ability to even publish articles on our LinkedIn pages and all that. That is a resource that you have, and the organizations that are publishing abstracts, articles, whatever it is that you're doing, you have the opportunity to shape that conversation. And at this point, I'll just let you know, for those who are interested in personal professional development, we have a website actually that is coming up, the Spark. It's already running, but we're opening up for more people to share their content with us, publish your content with us, make that difference, spark a conversation that needs hearing. That would be a difference for us. If you're focused on the health and you're a young professional looking at creating healthcare content that makes a difference, drive transformative change in your healthcare dynamics, Reculture is available for you. Join the Youth Voices Network. Let's see the conversation. Let's drive it together forward. But beyond that, then the question would be, how do you write your essay? Writing your essay, you will start from what is your background? What is your training? And that is critical, because your training gives you uniqueness to fit into that particular course that you're applying for. And that is why they would say you must have at least an undergraduate program, maybe with a 1 or 2 years experience. So before you even go to the experience bit is, what level of practice education do you have, and what were you educated on? So maybe in my case, I would say I have the Bachelor of Pharmacy undergraduate program education, which is a unique in terms of I've learned the healthcare management from clinical, public health, relatively into policy, and also the business management aspects of it as a healthcare professional. So I'm definitely well tuned to the dynamics in a health system, which is good for me. But then beyond the education, you need to ask yourself, what level of experience, what unique skills have you acquired over that period that makes you unique, and what are you passionate about? And that is where, for example, if I'm talking about public health as my pursuit of interest in the next career, then I would ask myself, if it is public health, what have I been doing in the public health space based on my undergraduate education, but also based on my experience post-undergraduate education? If you've been participating in public health outreach activities and programs, how does that link to public health? What problem are you addressing? If you're addressing a unique problem, that makes it unique, because one, I was maybe doing medical camps and medical outreach programs. These medical outreach, we understand that communities have a gap in access to medical services and medical products, often medications and medicines. So it means somebody comes to a hospital or a pharmacy somewhere, they get from a clinic, they'll get the diagnosis, they get a prescription, but they don't have the medicines, out of stock situations, so they'll have to go buy it. At times they don't have the money, meaning they will not buy the medicine that they need. By organizing these medical outreach programs, one, you're bringing the care closer to them in the sense that you've activated the community to come seek care. Some will come just for the counseling and support that they need, nutritional support and all that in terms of education, but some of them will actually be diagnosed, and when they're diagnosed, the question would be, are you giving them the medicine? Most medical camps and medical outreach programs have medicines, so you're closing the gap in access through that model. But the other bit that you also have to ask yourself is, what is the sustainability edge of that? One medical outreach will not solve the healthcare problems of an entire community. So your uniqueness would be the sustainability maybe that you look at. By the virtue that we're doing medical outreach, we are having structured referral pathways and partnerships with local clinics, with maybe pharma companies to design patient access programs for particular diseases that are of critical interest and need in those communities. So if it is malaria, I'm ensuring that I have a partnership with an organization that is selling anti-malaria medicines with a clinic in the local neighborhood, so they would be getting their malaria treatment for those who need it within the period, and also having access to rapid diagnostic kits in that pharmacy or that clinic. That uniqueness, that sustainability is valuable. And if you've been doing such kind of programs, you already have content to share, which is amazing. And I would commend you for doing that and doing amazing work that you're already doing. But there's one uniqueness that comes in that will differentiate you from every other person who might have already been doing that. Have you been documenting the evidence of the work you've been doing? If you've been part of an organization and you've been documenting and writing reports, then that makes you get an edge, because when you're doing your IC, you're not only saying what you've done, but you're also presenting evidence of what you've done. How do you present that evidence? For my case, I normally prefer having hyperlinks. If I'm talking about, let's say for example, my passion in addressing the gap in non-communicable disease management or neglected tropical diseases, I know my LinkedIn profile, I have a couple of articles that I wrote about this based on different experiences and different encounters that I've had in my clinical and professional practice. And in that case, then I was advocating for something and proposing a solution in some way, but I'm also still doing the same within the organization that I work with, both as an employee, but also both as an initiative that I'm pursuing and driving movement towards a better success. So then I hyperlink, let's say for example, it's neglected tropical diseases. I had an encounter in 2020 when I was doing my internship. This is a case where I lost a kid on 13th of February. When I lost this kid, the question I was asking myself, why did we have to lose this young child? One, diagnosis was a problem, because the child had been taken to hospital multiple times, nobody ever diagnosed. Instead of treating leishmaniasis, they were treating malaria. That was a problem, meaning the clinical suspicion was low. Then beyond the diagnosis and treatment, the patient moved to the next level of care, and instead of investigating for this probable leishmaniasis, we were investigating for cancers. Really, this clinical suspicion. Then when we determined, then we did the diagnostics. When after diagnosing we were able to initiate treatment, we didn't have reliable supply, so we have to talk to different government agencies to consolidate and get the supplies. Those are gaps. Imagine you link such arguments that you've written in your articles, and therefore the person reviewing your applications not only sees the passion that you have, but also sees the evidence that actually, even without this program, this person is already doing this amazing work. What difference would it make if we gave them the platform to gain the unique set of skills they need to be their optimum best? They'll drive impactful, sustainable change in their communities. And that is what all these opportunities are looking for. So can you link them? And in the other bit, when you're creating content, at times I think, for me, and I remember I had this conversation with one of my colleagues who was asking, she's working on an application, yes, and as much as she's working on an application, we had a conversation. I'm like, you do a lot of content, you do a lot of work in the space, in the healthcare space. So what uniqueness do you want to present in your case? And the question was, yes, you're doing content. Who are you doing it for? For young professionals. Then the young professionals, are they consuming it? Yes, they do. So what impact does it make in terms of driving health? Because you are a healthcare professional by practice and training, and you're training and sharing content with them to impact their lives. So what uniqueness is there? You already know the problem that you're solving. You're giving them the content. When they're able to be at their optimum best, they're able to practice effectively and efficiently. They're able to make meaningful contributions in their professional practice, which means you're driving the healthcare workforce, which is a component of the health system strengthening component. So you already see you're addressing a gap. You are enlightening the communities and the public in terms of healthcare consumption, managing their medicines, rational use of their medicines and all that. That is a unique, because the public health promotion and healthcare prevention is a critical bit. You're already intervening at that point. If you can consolidate all these small pieces and understand what is the framework of all that I'm working on, then you move it into the smaller pieces, you'll be making a difference. And on that account, I wish you all the best in your application. Most critical thing is, write your story from a personal experience and personal education. Look at education, professional experience, reference your articles, whatever sources of material that you have, so that there is proof of concept of whatever you're validating. Then when you move to the next frontier, what do you want to do? link what you've been doing to what the skills in that program will give you, and then how you would do it in a different level. And that is what in the previous video that I did, in terms of choosing the course, what impact and where do you want to practice. Where you want to practice will give you the journey of where would I apply these skills, how would I apply these skills. Makes a whole lot of difference. And as you're doing your application, all I can say is I wish you all the best in your journey. I wish you success that you desire, and make the best of your application so that when you come next year, September, when the new window opens, I'm sure that most of you will be going for your postgraduate education, and that postgraduate education will be a difference in your life, the difference in the family and the communities that you're going to serve post your education. If you enjoyed the conversation, subscribe to the channel, share it with your friends and colleagues, those who might have value who find value in it, and share your feedback and comments on how we can improve, what additional topics you'd want me to talk about, and let's make a difference in our communities. Thank you and have a good day.